Hello, Darin. Welcome. Thanks for joining us here. We're going to talk about implant components. We are looking at a multi-unit abutment and some innovation that you guys have. So here's a classic multi-unit abutment that we've all seen and been very familiar with over many years. And then here is the same multi-unit abutment, but just with a little innovation. So maybe let's just jump in here, Darin, and talk to me about the history of MUAs, and obviously these have been around a long time, and then the impetus or the idea behind this innovation to level up the quality of the MUAs and how they interact with tissue and all those sorts of things.
Yeah, sure. So the traditional MUA, as I think everyone in this audience, certainly you are aware of, is more the Nobel design. Came out when full arch therapy first came into to the norm, I guess, 20 years or so ago. And it's just a way to transition from the implant to a prosthesis, a full arch prosthesis where you can tilt implants
Yeah.
in order to miss nerves, not do sinus lifts, where you have some anatomy that, through bone resorption that becomes a problem. So these multi-units allowed us to correct for those angles and still rehabilitate an edentulous patient. And so this is the first Nobel design. It's kind of an industry norm, and it works. And it's a good, elegant solution, and it still works. We carry these and manufacture these for 25 plus different implant systems at DESS. And so we have a breadth of product. We carry them
Yeah.
straight. We carry them at 17-degree angle and at a 30-degree angle.
So you guys make a lot of MUAs. You have a ton of variety on your MUAs, and you make these. You are a third party component company, but you do some OEM for some big brand implant companies, and my guess is they do not compromise the quality standards that they hold you to. Maybe can you talk about that a little bit?
Yeah, it's one of the reasons I'm here, to be honest, Rob. At DESS, we are all of our products are first and foremost FDA cleared. And what does that really mean to the customer, right? It means that we go to the government and we take a predicate device and we say that our products are equal to or better than, in some cases, that predicate device. Now, the predicate device, it would be the original manufacturer. So whoever Nobel came up with this design first and maybe produced it, we go and prove to the FDA through third-party testing that our product is equal to or better than. So you should have confidence that the product is really good. More than that, we we ISO certified. So our manufacturing facility is our quality controls are looking. And I'm going to tell a personal story here, I guess. I came from Dentsply Sirona. I ran our Atlantis business in North America for a number of years. So I've been in that milling center a lot. And it's a really nice milling center. And I've had the opportunity to visit a lot of other milling centers. They're really nice. The Atlantis facility is really, really a good top-notch facility. I visited Barcelona when I was talking to DESS at our production facility, and I will tell you it's the nicest milling facility I've still been in. And again, I've been in a few. And so our quality standards are really high. They're FDA cleared for all of them. And you intimated we do make a lot of products for some of the OEM manufacturers, and quite a few of them actually. And this is one of those lead products we make for them.
Amazing. Well, that's good to know, because as a third party components company, I'm sure people come with their biases. Nothing can be as good as the original. But I know DESS works really hard to innovate and make fantastic quality products. So tell me a little more now about this new MUA Plus. That's what you guys call this. I see a unique geometry. I don't see any like sharp, flat angles.
Yep.
And then I also see looks like a coating here. talk to us about what is the innovation here? Why'd you guys do it? And what problem were you seeking to solve with this innovation?
Yeah, so it certainly is, as you can tell by the design, it's more tissue friendly, right? It gives a more aesthetic emergence, and tissue likes that much better. So it adheres to it. It gives a better emergence profile. So it just gives a better result, and it's easier to use for a clinician. And that's really the design change. Now, the coating on it is, our trademark is PerioCoat. And what's the significance there? What does it really mean? And it's a zirconia nitride coating that is industrially added to the titanium piece. And what does zirconia nitride do? The biggest advantage, and there are several, but I'll cover the most important first. One of the problems in implant dentistry is you get bacteria around a surgical site where the implant is, and you get every clinician knows this. You get inflamed tissue, red tissue, and that's never good. And it's a cause certainly from surgical sites, but it's mostly caused by bacteria getting there, and that can cause certainly inflammation at the lowest, up to perioimplantitis, where you actually lose bone and lose tissue and can lose an implant from that. And that's totally a cause from bacteria. Zirconia nitride, bacteria doesn't like it. It doesn't adhere to it. So when you coat an abutment surface that comes into contact with an implant and in the soft tissue around the implant, less bacteria is there. What does that mean? Less inflammation, less instance of perioimplantitis. There are dozens and dozens of studies that will verify this and show that zirconia nitride bacteria and plaque don't like it. And so you end up with less inflammation, less perioimplantitis, which are just better clinical outcomes. Makes for a more predictable tissue response. And then you combine the better soft tissue design from it, and you just get better outcomes. Additionally, I will tell you, the zirconia nitride is stronger. It makes the piece stronger. It's more scratch resistant, so you're going to have less as you clean it. You know, when they come in for hygiene, you're not going to scratch it and cause a pit where bacteria might form. Not as important with multi-units, but if you think about a locator abutment, we make a DESS lock abutment that is coated with zirconia nitride. And as you're taking that prosthesis on and off, the wear and tear of the inserts and the processing sleeves over the top of a locator abutment will wear. It wears less with zirconia nitride. So it's stronger, less scratch resistant, less wears slower. But the big advantage is really the bad germs don't like it.
Well, yeah, if I were to just toggle back and forth here with the same abutment, we can see clearly a geometry that tissue is going to like. And then now we have a coating that bacteria is not going to like. So that's really a twofer, right? You're innovating two significant things. And what's really cool about this too is, obviously there's a price difference. It's roughly double the price for this innovation. And the average patient would never know, right? Like the average patient is never going to know or care or have an opinion about the doctor. The doctor's probably not going to disclose, hey, I'm giving you the Cadillac multi-unit abutment. And the patient's going to be like, what's that? Right, doc, I just expect the doctor to give the best treatment, right? But this is kind of one of those things where, like, if I was getting treated or someone I loved was getting treated, now that I know this, Darin, I probably would micromanage the treatment a little bit and be like, all right, you got to use this MUA here because it's going to be tissue friendly and bacteria unfriendly, which are two really cool things.
Yep. I well said.
You mentioned implant failure could be caused by bacteria and other number of things. Tell me, does DESS warranty the whole site, the components and the implant if there were to be a failure? I know one of the big arguments against a third-party components company is like, well, if I put a non-brand abutment or MUA on my brand implant, my implant company will tell me, oh, you void the warranty. Well, how does DESS support the site, the implant, the components if there were to be implant failure?
Yeah, yeah, it's a great question, Rob, because it's always been a concern. I've been in dentistry, over 20 years in implant dentistry, so it's always been a concern from the clinician's point of view and from the laboratory's point of view. They want to make sure they're buying parts that they're supported and that are warranted. And if there is a problem, which fortunately in implant dentistry today doesn't happen often, but when it does, it's time consuming to rehabilitate and redo something, and it's costly. So it's a big concern. And I think back 10, 15, 20 years ago, and there probably was, there was a coordination or a partnership between OEM manufacturers and laboratories, and that's kind of changed a little bit today. So what do we do to get to specifically answering your question? Do we warranty our part? Yes. So we have a lifetime warranty, not 5 years, not 7 years, not 10 years. If you use DESS parts, we want you to be confident that you're backed up. Lifetime warranty on the implant, no matter what the implant is. So if you
place the whole site,
whole site,
implant, screw, component, tie base, doesn't matter, everything.
Fully covered. I don't want customers that put their trust and confidence in us to be scared to use us because of a warranty, or the OEM to scare them that they won't cover it. At the end of the day, it doesn't matter to us. If the OEM won't cover their warranty, we will cut them a check to replace that implant in that patient. Look, we're that confident in our quality. We're that confident that we won't have enough of these, that we don't want to cut checks. And we're confident it won't happen. And very rarely does an abutment cause an implant to fail. But if it does, just like the implant company, we will warranty.
And it's a no questions asked warranty. So if they just take an x-ray, document a little bit, show the DESS components are on it,
yeah,
you will cover the whole site.
We have a warranty claim form. We send it to them. They give us the information. I cut them a check.
Rock on. I love that. I love that. So you're covered with DESS. Okay, that's heartwarming. That's good to know. So as a lab technician or a doctor, we're not going to be sacrificing the warranty claim by putting DESS components on a branded original implant.
You should never be, not one concern. Shouldn't even blink an eye.
Okay. Good to know. All right, I want to talk a little bit about screws. Now, I don't know very much about screws. We were talking earlier, and you're definitely educating me. There's a lot of options out there, but you've recently come up with this full arch screw. Just a few months ago, you told me that has a flat seat. Maybe tell me why this is important, and then we'll show some of the other pictures there, but just talk us through this screw innovation here.
Yeah, so one of the industry trends is traditionally, when you were doing a full arch case, you would put a multi-unit abutment into the implant. You would then put a tie base on top of the multi-unit to transition between that multi-unit and the prosthesis. And then you would use a prosthetic screw to go through the prosthesis into the top of a tie base. Gave a little bit more stability and security to the restoration, corrected for angles for sure. Challenge with that, the latest trend in full arch dentistry is you put the multi-unit on and then you go directly through the prosthesis directly into the multi-unit and you bypass a tie base. It certainly makes it more cost effective. And the challenge this kind of brings is we're also shifting to an all zirconia, monolithic zirconia restorations, right?
Yep.
And so screws weren't designed specifically for this purpose. And so we were catching up. And the screws that were used and to go were longer screws, but they weren't really designed to interact with zirconia. And so You would have screw loosenings, you would have misfits, you would have screws getting stuck in the seat, or collisions with the mill path for the screw inside the zirconia restoration. So it caused some problems. Not every time, but on a high enough percentage, screws loosening, things like this. A high enough percentage of the time that we looked at it and we're like, we can do better. And so we designed this screw from the ground up specifically for this purpose. So you're going to use our flat seat full arch screw for a direct to MUA through a prosthesis, and it really does a few things for the clinician in the dental lab. One, you can angle correct with it. It's an angulated screw channel. It gives you up to 25 degrees with a torque screwdriver that you can correct with angles with the screw. If you'll look at some comparisons with our screw and a competitor, it gives you longer threads. What does that mean? You're engaged more.
I see some threads above the platform here, some extra threading.
It's just better stability. It engages more, so you're going to have less instance of screw loosening. If you look at our head, it's a wider, flatter head, so it rests against zirconia flat to flat. Zirconia doesn't like jagged. Flat to flat, it means less stress on a zirconia surface. You're going to have less microfractures, which this picture shows.
Well,
it disperses forces better. Yeah.
I want to show the comparison here. Here's a conical screw, a popular one. And if we look here at this heat map, that conical shape and being torqued into place is applying outward pressure to the zirconia. And we know zirconia is a very strong material, especially in compressive forces, but I got to imagine you've got a screw channel here, which is already compromising the overall strength of that zirconia. And now we're going to apply pressure, and maybe even depending on how much pressure, how many Newton centimeter you torque that screw in, is going to apply this constant pressure against the prosthetic. And then you've got some thermal shock happening, hot and cold, and some other, obviously you're chewing. I mean, the mouth is a pretty terrible environment. And I just got to imagine this conical screw could be a problem or a root cause to contributing towards zirconia fractures right at the screw channel.
Would be an interesting study. I know we have a lot of instances of screw loosening with this, which, and I would say, even if you look at the chart on the left, Rob, even on the sidewalls, there are, because of the taper, it's going to move. That's never good with zirconia. You want a more stable atmosphere, which, we're providing. It'd be an interesting study to determine of failures. When you have a failure, you think of, what was it? The implant's fault? Was it the prosthetics fault? Was it the lab's fault?
The screw's fault.
We've never heard the screw's fault, but it's possible, right? And this certainly illustrates it could be. And we're never going to be, I always joke, nothing is 100% in dentistry. Nothing.
No.
Except
so we call it practicing.
Except extractions. You can always get the tooth out. But this,
and when you get it out, it's never going back.
That's right. This will lessen the incidence where you'll have some type of a problem in a full arch case. At least that's the reason for the design and the reason we innovated here, to help doctors give more predictable outcomes that last a long time, and really creates value for the dentist. They have to spend less time redoing things that is expensive.
Yeah.
We want them to last longer and be better.
Well, looking at this flat seat screw here, I for sure like the forces just being pressed down on zirconia, this compressive force, as opposed to being pressed outward on the zirconia. So, if there are any doctors out there listening to this that are involved in this research, if you want to correct me or correct Darin, and our hunch here is that this flat seat screw is going to be much more friendly to zirconia than a conical screw. And you can definitely see that there. That is a really cool innovation. Obviously, you guys sell lots of screws. hundreds of screws on your website, but this is a really cool innovation as well. Anything more to say about the flat seat screw?
We've been happy with it. It solves a problem. And as all of our products, look, we're a third party company. We make really good products, but we want to do it in an affordable at an affordable rate for our customers, so our customers can be profitable. We don't want to compromise on patient outcomes. First and foremost, we don't. And I think this is something that actually makes life better for dentists, for laboratories, and for patients. But we still want to be affordable. We want to make sure that our customers can make money.
Yeah.
And so this is still priced very, very competitively to allow. We built a better mousetrap, and we still, we don't charge an arm and a leg for it, and that's with all of our products.
And so to buy from you, they just go online, buy on your website. You can see all the products here listed, and obviously I see some great prices on more of the standard screws, which I think it's great. So run over to DESS.com and pick some up. I want to transition to scan bodies. Growing up in the lab and, the early days of iOS scanning with scan bodies was a whole learning curve. And then there was the early reality of iOS scan bodies and lab scan bodies. And the doctor had to use the right iOS scan body. And if for some reason they put a lab scan body in there, now that's causing a problem. We're not lining files up properly in the CAD design steps. You guys have solved that by having just a one-size-fits-all scan body. So your scan bodies are for iOS scanning and lab scanning, and it's the same geometry for both, right?
That's correct. That's correct. It's one product. So this scan body you see for the 3.0, the first one in top left, you would use that in the lab environment. You would use that in a clinic environment inside using an intraoral scanner. So it can be used for either product or either way, whether it's being done in the lab or in the clinic in the patient's mouth. Same scan body. It's made out of titanium, Rob, so it's autoclavable. So if you're a clinician, it's reusable, which is important. You don't have to buy one of these every time. They are made out of titanium, and they are coated with zirconia nitride, by the way, if you see that.
I was going to say, I see a nice rough surface, which is very scanner friendly, right? We don't want reflective surfaces to scan. We want, matte finish type surfaces. So that's really cool.
It picks up really well, and it doesn't have a hex in the top of it. So you get a very, very accurate scan with this scan body. It's a good scan body. It's a really good scan
talk to us about that a second. You said there's a carrier. Is that this guy right here? This carrier that goes over the top of the scan body and it's hand tightened. Is that correct?
Correct, and it comes packaged with. You have one packaged with, so it's you use your hand to insert the scan body, where's that valuable? If you're in the posterior and you have limited occlusal space, sometimes it's hard to get a screwdriver back to get, even a healing abutment in, much less a scan body. So it's advantageous there. Our scan bodies are narrow, so if you're lower anteriors or you have limited space between teeth, it's really an elegant solution. Sometimes, the advantage of having a screwdriver is it sometimes is easier to get it in because you're in the mouth and you have, lots going on there, as you said. And so sometimes just with your hand with a glove and you get saliva on the glove, and it can be sometimes, more advantageous to have a screw. That's the downside. But, from an accuracy standpoint, from being able to use anywhere in the mouth, we're proud of this. And again, you can use it anywhere at a lab scan, at an intraoral scan.
Yeah, and something that a friend of mine, Brandon Smith, was mentioning is that a lot of your scan bodies are thinner, like a smaller diameter. So for like lower centrals, they're a lot more friendly for smaller implant sites than some of the larger scan bodies as well. That's amazing. So huge selection, all zirconium nitride coated. Is that correct?
That's correct. Here's something I'll share too, from overall scan body category, and I don't know that I've ever spoken with you about this, but one of the things, as we get more digital, this is the entrance place. This is data capture, right? So accuracy is super important. I think we have that figured out. But then you have to take it and put it into a computer to design whatever you're going to design. Or it's a single abutment or a full arch. Our libraries are, I would categorize them as some of the best in the business, meaning for scan bodies in particular. If you're a dentist and you have, everyone wants their scan body. So if you're using Straumann, you have to have a Straumann scan body to use their parts, or an Atlantis scan body. To use Atlantis, you have to have an Atlantis scan body. So you kind of get tied into their system, which makes it difficult for labs and clinicians. For clinicians, they have to buy a bunch of different scan bodies depending on who they're sending it to. For labs, they have to manage all of that data.
Yeah.
Which is difficult. So our library now takes the 8 most common scan bodies, and there's a lot. It doesn't matter what scan body is used in the clinic. It can convert into a library that is used to now digitize and design whatever restoration is going on. So whether if they're using an Atlantis scan body, an Elos scan body, a Straumann scan body, a Neodent scan body, the top 8 scan bodies, we convert them using our library. So it makes it, for a clinician, you don't have to buy a new scan body. If you've got one of those 8, you use it, and you can still use DESS parts. If you're a laboratory, you worry less about having to, what scan body's coming in. I just use this library, and chances are it's going to work.
Awesome. That's really cool. I love it. So innovation in scan bodies, innovation in screws, innovation in multi-unit abutments. So, you guys are for sure more than meets the eye. You're not just a third-party components company, right? I mean, you guys do make a lot of great components, but I see some great innovation here, some great thoughtfulness in the implant category with these innovation behind components. Anything else to mention that's unique about DESS for our audience?
Well, one thing about us is there are other competitors that make good products. I'm not here. We're easy to deal with. I want to be customer obsessed, not just focused on the customer. I want to be customer obsessed. So we will react to customers' needs, and we're small enough to be and agile enough to, if we have customers that have ideas on how we can do something better, we can pivot really quickly. Most of these ideas came from customers. And I can give an example of this. We just launched a fiduciary marker for photogrammetry.
Let's go check that out. Is that in here?
It is right there. So I was talking with a customer, and they were telling me they do a lot of photogrammetry and a lot of full arch cases, and they were telling me that their biggest challenge was with fiduciary markers, in that you either had to print something to go over the head of them so they would be picked up on the scans, or they would drop out of the screwdriver as you were putting them into position, or that the scan head wouldn't pick up well. And so we worked hand in hand with this customer to develop a fiduciary marker. This has been on the market 2 months.
Wow.
And we developed it in about 6 months, and have had it tested, and we've had really good early success with it. But again, it just, one of the things I would tell you is we're flexible, and we can innovate really quickly. If we have customers that have ideas or needs that help solve a problem for them, we will listen to them, and not just listen, but we'll actually act on it. Look, we make parts for a lot of systems. We can streamline your implant inventories and kind of, you hear one-stop shop a lot. It's overused, but we can actually be that and give you high quality with a cost of goods savings. And that's really what we do. We inventory things here. We have a distribution facility in Orlando, Florida. Don't hate, the weather is great here. But we can get things to you as soon as you need it, overnight, second day, whatever your preference. We can get things to you quickly. We carry 2,000 SKUs, and we just want to be customer obsessed at the end of the day, Rob.
Yeah. Well, I love that. And I love this purpose-built fiduciary marker here. I'm seeing some nice, sharp lines to grab in the scan, a non-reflective surface, so a nice purpose-built fiduciary marker. Obviously we've seen doctors, use all types of devices for fiduciary markers. I mean, you can use teeth as fiduciary markers and other types of screws and stuff, but a small round screw with a reflective surface isn't gonna be great,
No.
right? But a screw like this that has sharp edges on it to really grab that, and the non-reflective surface is gonna be awesome. So this is cool. Anything else? Any other breadcrumbs? Any other new innovations that have just come out?
Just not today. Maybe
Not
next
today.
week. Maybe next week.
Okay,
Yeah.
next week. All right.
We're proud of what we do. We like being in the dental implant space. Again, I'm passionate about this. So thank you for having me and helping
Yeah.
me get the word out about DESS, because I think we have a value proposition for dentists and for dental laboratories.
For sure. I love the innovation. I love the MUAs. I actually didn't know about that, and definitely learned some stuff about the flat screws. That's really cool. And so thank you for sharing. And if you have any more innovations coming, let us know and
You
we'll
got it.
talk about those.
Awesome.
All right, Darin, thanks for joining me.
Thanks for
Be in
having me.
touch.